podcast friends. I'm Dr. Amy Brenner, and today we're going to talk about symptoms of estrogen excess. Now, estrogen does so many good things for our body, and when your estrogen levels decline, you really start to feel it. I'm 55 now, and when I went through menopause 2 years ago, I started having the typical symptoms: hot flashes, night sweats, joint pain, particularly like in my fingers. And when I tested my levels and realized it was time to add estrogen to my regimen of testosterone and progesterone, it really was a life changer for me. But just like with all the hormones, too much estrogen is not a good thing either. So what are the side effects of estrogen excess? I call them the 5 B's, and those are bloating, breast tenderness, bleeding, bad mood, and belly fat. So let's unpack those a little bit. The first one is bleeding. Now, that one's a little tricky because although that can be a sign of estrogen excess, sometimes it can be a sign that there are other things going on, like polyps or fibroids, because those things can have estrogen receptors on them. And when you start estrogen, they're kind of waving like, hey, here I am, do something about me. Also, when somebody first starts estrogen therapy, in those first 3 to 6 months of therapy, sometimes it can also be just a normal finding. But also, it can be that you have too much estrogen relative to progesterone, and that's why you're bleeding and it needs to be evaluated. The next one is breast tenderness. Again, sometimes when somebody first starts estrogen, it can be just a normal finding and transient, and these go away. But if somebody is getting too much estrogen, you can have significant and persistent breast tenderness. Bloating. Nobody likes that feeling of bloating. And although there are lots of other causes of bloating that could need to be evaluated, such as gut issues, or even issues with the ovary, sometimes it can be just as simple as estrogen excess. Bad mood is another one. If you're in an estrogen dominant state, which is very common in the perimenopause, and an inexperienced provider hears you and says, oh, you have hot flashes, it must be estrogen, and they just add estrogen to your regimen, particularly in the perimenopause period, that can make a lot of these symptoms worse, particularly bad mood. Usually it's not more anger issues, but more emotional issues, weeping. We even see this in men. Now, men don't make estrogen. They get their estrogen from testosterone getting converted to estrogen. But if too much of that testosterone gets converted to estrogen, even in men, it can lead to issues with mood. And then the last one is belly fat, which again leads to this estrogen dominant phase of too much estrogen relative to progesterone can be an issue why women are holding on to belly fat. So again, I'm not here to bash estrogen. I think women need estrogen. And when you go through menopause, estrogen has 300 plus effects in our body. And without estrogen, you're doing yourself a disservice and leading to a higher morbidity and mortality, which means to a lot more diseases. But more estrogen is not always the answer.